Well, welcome everybody. This is Rise Up number five. We started this last year with a group of friends of mine, Kyle Stanley, Ricardo Madrani, Israel Putterman, um, and Martin Mendelson. Everybody, all of us have had our own story as far as stress and the battles of dentistry, and I think in a kind of a core mission to help others realize that we all got the stress. And if you let it take a hold of you, it can bring you down a spiral of affecting your family life, your practice, you know, your well-being. And for me, stress has always been something I've been able to manage quite well. And it's a matter of fact, if I don't have it, I it's like a drug, right? So without stress, it's not my life. And I've been able to manage it until we have some family things. With me, it was my daughter, and it brought me to this new level of need for help. And I didn't really know I needed help until it really got kind of dark for me. And thank goodness I was led to Chang here with us tonight. That it really I sought him out first because we had mutual patients and mutual colleagues. Sought him out first just to work with him more because of what he does and what he stands for, and his belief system on wellness and spirituality is critical to me. But I sought him out as my physician. I needed to make a change. I had a traditional, medical support team, a cardiologist, because my father had passed away quite young from a heart attack, and still have. I don't see him much. I don't need to because I'm much healthier now than I was a few years ago. But Chang really dramatically changed my well-being with somewhat of a simplistic approach. Stop all your meds, eat better, don't drink alcohol, and take some focused supplements. But really, I think over all of that was self-awareness and realizing there's been traumas in your life. And even though you think you manage stress well, you not quite really. You just kind of let them sit and they weren't really managed. So introducing me to breath work and dragon breath and Mira Jane, who will join us next year, who's a very unique therapist. It really profoundly changed my well-being and tolerance for stress, sleep, and many other things. So that's kind of my journey in this. And Rise Up was started amongst a group of dentists that, believe in this and want to help fellow dentists become a better version of themselves for their practice, for their patients, for their families, for whatever. And I believe now the next task of ours is let's link up with our medical team that are like-minded and have similar core values and want to help others. And I think it's so apropos to have Chang be our first physician on Rise Up tonight, to talk about how critical this is to our well-being, and then dive into what has been his unbelievable journey on technology and how that can really transform what we're talking about right now on helping others. So with that, Chang, good evening. Thanks for joining me, man.
Heck
I really
yeah, thanks for
appreciate
having
it.
me. Excited.
Yeah. So if you don't mind, just start out with kind of how you got to where you're at as a physician, functional medicine physician now, and how you got there. And then if you can dive us right into where you see the future taking us.
Oh, good question. Um, I was born in China, so like my perception of what healthcare is hanging around with my grandfather when I was 3 years old with a line of villagers outside and my grandma in the kitchen cooking spleen and liver infused with herbs, and then people gathering around to fight off whatever community viruses or bacteria that are in the actual village. That's my perception of medicine, right? And in fact, that's still my perception of medicine. And one of the things I really learned from Grandpa is the power of the placebo, right? So it's like you have to get people to understand that they can heal and they will. And you yourself, doc, you have to understand that they will as well. So it's unwavering faith is what makes a good physician, which I just thought, okay, well, great. Everyone believes that, right? So, and then going through training, it wasn't quite like that. So, I started my career not in medicine, but while going through school and residency, I started a digital marketing company. I was also did some time with in New York, training on body language analysis. And working with suicidal ideation and NYPD during my chief residency year. And that opened my eyes to a whole level of understanding. So as many people in marketing understands that marketing is basically spells with words, and then so is psychiatry, actually, so is psychology. And so what we are the language in which we utilize is our ecosystem. It's actually how we it's our it affects how we process everything. So everything is sort of our reality, right? And so like going into internal medicine when I first finished, it wasn't really what I signed up for, but it gave me a really great, amazing experience. And off the bat, I joined a really amazing practice. They're still amazing practice. They're awesome people. But I wanted to do something a bit different, which is look at it from the language side, like the language in which we utilize as clinicians really affect patient outcomes. And when I first started, I did sports medicine, primary care, inpatient medicine, and hospice. But hospice is where everything was nice and peaceful and understanding. And I started realizing that looking at the studies, people were living longer in hospice than aggressive therapies and lung cancer and all sorts types of different things. And I finally understood that what Grandpa said was right, and my mom, who's an acupuncturist and herbalist as well, said it was right. Is like everything is the power of the belief system. And so when I started going into functional medicine, I guess this is 2015, 2016, and I kind of opened up this new world into what's called naturopathic medicine, which it was not just a new world, but it really made me understand physiology a whole lot more. And it's in functional medicine that I actually discovered dentistry, actually, because they taught dentists there to talk about like grinding and bruxism and related with adrenal fatigue, which ultimately had to screen for sleep apnea, which is not what I even heard about in medical school, right? And so started working with dentists early on, even in my previous practice, and referring even when I was in my previous practice. Sue, you're in here. You're the first one, actually, one of the first ones. And so I think that in understanding all this, when I got into like understanding functional medicine is also not what it's cracked up to be as well. So there's missing parts in each type of medicines that are there, and it all had to do with understanding communication and vernacular and presence and really holding space. So early on, I understood that I think part of the value of what a clinician is getting the patients into a space where they feel safe. And so you switch them from there being a transaction into more of a transformation, right? So a lot of patients come and you do your thing and procedures and stuff like that. So that's the transaction. But the transformation is all in language, right? It's all how you present yourself. And so this thing called the bedside manner, right? And at that time, bedside manner wasn't really quantified. It is now, but it wasn't really quantified. And so, so the power in language is still very robust, and it still continues to be. And in fact, it's going to be even more so, more valued in the power of language connection. When we're able to connect with people, our colleagues, right, our patients, and stuff like that. But man, is there a lot of burnout in healthcare, right? Medicine, dentistry, nursing. God, there's a lot of it. And then all of a sudden, 2020, this thing called COVID came out, and I did one of my summits during that time, and got blacklisted on Facebook for a year. And one of the things I talked about is, hey, maybe like resting and sleeping and getting enough vitamin D can potentially like prevent this. which is now on the CDC website, but I got censored for that back in 2020, right? And so I started realizing that who's really in control here, right? And it's media, and who is in control of the language, which is also media as well. So language has always been really powerful. Also, 2021, we see now the emergence of AI. So, and we adopted AI 5 years prior to ChatGPT even came out, which at that time was super clunky, relatively speaking. Artificial intelligence is the most it's as important to mankind as fire. It's because it's the first time where anybody can manipulate reality through coding. And when I say coding, I mean words, right? And so before you have channels and media companies and stuff like that, and their form of coding is TV programs and YouTube and stuff like that. Now we have a whole other different beast, which is LLMs, large language models. And large language models have drastically shifted the way that all humans have perceived reality. And if you think about it, how many Bigfoot reels do you see on Instagram right now, right? Or TikTok?
Yeah, right.
There's a lot. And I think that when you think about holistically what's going on in the language world, it's also what's going on in the medical world as well, and that's what's driving burnout. So we quickly realized, Todd, that a lot of like burnout is transactional medicine, right? So a lot of burnout is having so many transactions and being valued solely for the transaction. And original transactions is either procedures, consults, labs, whatever it is, right? It's some transactional. And then it's also knowledge. But today's November 20th, 2025, the value of knowledge is dropping. The value of human connection is going up. So not surprisingly, you have Harvard study, Stanford study looking at humans interacting with artificial intelligence with a preference rate of 7 to 1, the interacting with a healthcare professional on language outputs, right? So we're seeing that artificial intelligence language models and the way it's prompted is actually winning when it comes to human connections. Well, it's not really a human connection. So I do think that we're on the cusp where especially mental health and health providers are either going to go up or it's going to go down. And there's a lot of things that are kind of in the way that we have to kind of make blossom, which is artificial intelligence.
Yeah. Yeah, and that's really where we want to take it tonight is that foundationally functional medicine, at least to me and my perspective as a patient, and then, getting to know you really well as a friend and colleague, is that it's uncovering things that our medical system just hasn't done, right? And looking at uh, way more root cause of things versus band-aiding illnesses to sustain some level of health versus getting to the root cause and creating true health and wellness. So that indeed, I think, is a great thing to discuss for dentistry and medicine. So can you touch on that a little bit more about
Yeah,
for
absolutely.
the people suffering out there that really it's whether it's addiction or depression or even just self-awareness and stress. Kind of touch on that and how you take someone that's struggling again, no matter what their struggle is, how you take them and simplify it, take a simplified approach to help them out. And then we'll dive a little deeper into AI and what we're doing right now to help ourselves, help our organization, to help our patients. But if you can dive a little bit deeper into your daily practice and take an example, a guy like me, how you help someone like me that many physicians had seen and no one really could help.
Oh man, yeah. So it takes a team to be honest, and I can't do it myself. I think I've always been strong in team development. One of the things I learned earlier on is to hire up, meaning that hire people smarter than me,
Yeah.
at least in one or four categories, right? And now feel like all the clinicians in my practice are actually smarter than me. And so I've always been a data guy. And as a data guy, as a data nerd, I assigned indices to data, meaning how important a data point is. Um, I would say that functional medicine is about 50% there. Integrated medicine is about 60% there. Lifestyle medicine is about 40% there. So let's call it collaborative medicine, where we want to be able to collaborate with everybody. Because the problem with secularized descriptions of medicine, just like dentistry actually, is that it sets up hierarchical systems that create a lot of resentment. So currently my identity currently is that we're a collaborative medicine practice. But one of the things that we collaborate with people is data. So it doesn't matter which doctor or dentist or physical therapist or dietitian gets data. Data is data. So what we want to do is we want to collect all the data and understand it at a deep level. Now, my brain cannot do that. But machine learning and artificial intelligence can. So these are called cognitive engines. So in 2015, 2014, I got into machine learning. And so I basically collected data, and then the functional medicine allowed me to collect more physiologic data, which is awesome. And then 2017, I got into EEGs, my favorite thing in the world right now. So EEGs have different subsets. There's the EEGs that you use for seizure disorder and for sleep studies, and then there's quantitative EEG, which is basically looking at physiologic models. It's not used to diagnose, but it's looking at physiologically what's going on. And then I saw this pattern when we first started getting patients from the VA hospital. We had a PTSD program, and this pattern is labeled theta beta ratio, which is sort of this ADD pattern. I'm like, wow, why does everyone have this ADD pattern, right? And then, what really is theta beta ratio? Then I met Dr. Simmons, Gerald Simmons, and he's like, oh, theta beta ratio, theta you're sleepy and beta you're awake. You're sleepier than you're awake. Maybe it's a sleep disorder. And we start identifying hypersomnia and reframing mental health diagnosis into hypersomnia, and then we start predicting sleep disorders and narcolepsy. So, and now we can predict narcolepsy with a 92% positive predictive value that we published last year in June, right? So that's a tertiary data no one was really looking at, but he combined that data with more of the functional medicine metrics plus conventional medicine metrics plus neuroimaging, MRIs, PET scans, stuff like that. The data doesn't lie, is that at the root of a lot of people's suffering is inability to sleep. And inability to sleep can either come from a sleep disorder or PTSD, insomnia, et cetera, right? And so what sleep really is, in the way that Chinese medicine is sleep is safety. And so when someone can't sleep in Chinese medicine, it's, oh, you have a lack of safety. You have a safety deficiency. Okay? What's causing this safety deficiency? So when we take someone through this journey, we don't call it like a sleep disorder. We call it a safety issue. Let's look at all the elements around safety. What's in your environment that's making you not safe, right? Is there physiological things like sleep apnea, right? Restless legs, PLMS, stuff like that? Are there nutritional deficiencies and everything like that? Like something is causing the body like not to feel safe. And whether it's a mental health issue or physical health issue, we don't distinguish between the two because it's a physiology thing. So the your brain electrical activity does not really distinguish whether it's a physical thing or a mental health thing, because everything is part of the same physiological effect that we see from an EEG model, right? So I think that, Todd, allowed me and my team to ask higher quality questions whenever we see a patient. Because we talk about mental health and trauma and childhood trauma, and we assess for all these things, right? And when you ask for it, people are often sharing that for the first time. They're sharing with another human that, hey, something has happened before. And so we created this network of people that allow people to feel safe. You know, Mira is one of them. You know, Jenny on our team. There's all sorts of people. It's like, hey, you're safe to be here. We're not going to judge, but we're only going to look at patterns and how can we pattern ourselves out of this, right? And so, and then we start realizing that the body starts manifesting trauma, both physical and psychological trauma, through our autonomic nervous system. And then people get, autonomic dysfunction, dysautonomia, et cetera, et cetera. So we see sort of these diseases that are like all these murky sounding diseases. A lot of it is rooted in our perception of reality. But the studies have shown, especially in the last 2 years, that the perception of reality, um, anytime you can change the perception of reality, your body physiologically changes, right? And I'm just looking at my notes on my screen right here. So one of the things that came out uh, a couple months ago is that MBCT, mindfulness-based cognitive therapies, and rumination reduction, right, significantly reduces depressive symptoms in a very, very fast speed. And then what happens in the EEG? You see neural networks changing. You see hypersomnia like improving as well. And so this is important because 3/4 of hypersomnia and sleep disorders is identified by the dentist, not the primary care doctor, right? And so whenever you see the bruxism there, well, they're already starting to have issues. Whenever you see TMJ issues, well, it's TMJ is compensating, so there's already issues that are there. But these are basically data sets. And thank God for AI, because our AI combines all the data set and say, this is the data that we're seeing. This is the pattern that we're seeing. And we recently hired two new practitioners to one neurologist and one nurse practitioner to our practice. And they are now empowered with this AI data set that's able to demystify a lot of what we see in medicine and call it for what it is. Like I don't like to call it depression. I don't like to call it anxiety. I don't like to call it panic attacks or mania. I like to call it what's causing the safety deficiency, like in you and in your life, right?
Right.
Because
Yeah.
safety deficiency is actually quantifiable on the EEG, right? But anxiety is hard to quantify. Depression is hard to quantify. So let's look at physiologic mechanisms first, and therefore we can really destigmatize like what mental health is supposed to be, especially for healthcare professionals ourselves as well.
Yeah, they're under so much stress. And the brain mapping thing, I just think about my instance of where you
Hmm.
saw things and through a pretty simplistic approach, you reverse things that typically you wouldn't see reverse. And that's a pretty powerful visual context for a patient to see that you're making change with really just from good living, right? Good clean
Right, right.
living and working out some of the stress that you're really not, you think you're working it out the correct way, but you're really not. And that shows up in the brain mapping that you're doing. That was a pretty powerful thing that you showed to me that I think that a lot of healthcare providers out there, especially in dentistry, that maybe they're treating sleep patients, and we're all treating stress patients, right? So how
Yeah,
do we
for
take
sure.
it to the next level to really help them get better?
Yeah.
Um,
We really we can't secularize dentistry and medicine anymore. Like it's illogical. And from a data perspective, it's really annoying.
yeah,
Right?
yeah.
Like it actually doesn't make any sense. I think like and even all the other allied health professionals, it doesn't really make any sense to separate it, right?
Yeah.
So if if we were us 50 years ago and we look at 2025 and we look at the way that medicine is set up, we would call ourselves absolutely insane. Like why would we even do this? It's because 50 years ago, physiology was the main value in the practice of medicine, not diagnosis codes, right? These days is diagnosis codes. Here's a letter of medical necessity for your sleep appliance. Like, come on, it's a silly thing to do. And it's because a lot of what we do has been commoditized. A lot of what we've been doing has been like these large data sets collected by EHRs. And EHR is, according to Medscape, is the number two reason for why physicians become depressed and burnt out. And so, like, we have data, but what EHRs are supposed to be is not what it was intended to be, right? And so you have data, you have compartmentalization of data, and then you have healthcare professionals that are in here like, we didn't sign up to do this, man. And we want to do well for the public and for the patients, but that burnout is really serious. So gone are the days when, of my grandfather practicing medicine in the village and my grandma, cooking herbs and spleen on the side right here to heal the village, right? And now enter this world of more of a transactional relationship with people. So I do want to kind of define brain mapping. So brain mapping, there's different names for brain mapping, also different brain mapping. The most famous one is the one that people hear about on like PBS and Amen clinics. And when you check into your Hilton, he has his own channel. Dr. Daniel Amen is actually one of my good friends. And at the Amen clinic, they do something called SPECT. And SPECT is basically using nucleotide tracers to see the utilization of sugars in different parts of the brain. And so they could do a SPECT at rest and SPECT at stress and the delta difference between the two. They can also identify like sleep apnea and stuff like that on there as well. And now EEG is different. EEG is looking at electrical patterns, and the electrical patterns are go through a computerized calculation and is depicted in color formats. And these color formats tells us how far away from the standard deviation electrically is the brain under stress, under 27 minutes of stress. We put people through. And so this tells us a very different of data set. And it's very consistent because if you do it Monday, Tuesday, Wednesday, if you do it next month, the following month, it's probably going to look the same. But what I start realizing, Todd, is the most drastic differences between their first brain mapping and their second one is they can actually get sleep. Okay. So we're talking about CPAP, we're talking about appliances, we're talking about mind body medicine therapeutics, some breath work. So these are the people who have the biggest delta changes in the neuroelectrical EEG signaling. But not only is that changing, the hormones are changing. People can activate progesterone now all of a sudden, it turns to testosterone. And people can lower their sex hormone binding globulin, they can lower their CRPs. So we're seeing biological and changes that are these biomarkers that we in medicine call it, cardiac biomarkers or vascular biomarkers. And the biggest changes are when people sleep. That's the biggest changes, right? And and I accidentally found that. I didn't intend to find that, but I accidentally found it. And when I found it, it was really amazing. So 2018, I did my first conference called Functional Medicine Grand Rounds, where I actually presented before and afters of oral appliances. I don't think that's ever been done before. And we see these massive changes before and after oral appliances. You can find me on YouTube if you just YouTube my name and put oral appliances. But we have this before and after oral appliances of constant EEG data. But there's a lot more to it than that. Maybe sometimes people need other therapies. But I will say this, the biggest changes outside of oral appliances is mind-body medicine. So we started a mind-body medicine program with breath work and trauma programs and stuff like that. And I'm lucky because I actually get to do this within the traditional insurance market and Medicare. So I kind of figured out how to do that. And so I think that like when we think about the progression of medicine, we have to look at data. Now, enter November 20th, 2025. All the data that we've collected originally was in a machine learning model called a cognitive engine. And now it's in a Gemini model. Most recently, Gemini 3 came out a couple days ago. Now it's in a Gemini model where I'm going back and AI is analyzing all these years of data, and we're seeing brand new things in there that I didn't even think about to even
Yeah.
look for before. I mean, that's huge. So I think the AI era is here, and we don't have to fear it, but we have to use it to answer the higher quality questions of like what really is medicine. We have to kind of redefine that.
Yeah. Yeah, and we had a seminar last night. I was texting you while we were talking about AI in our organization and how we have to test it and use it and figure out what works and what doesn't. And the guy that we were talking with, it was our interim CEO for our organization that's left and is a great friend. You know him, Josh, and he's gone and done the MIT AI and now he's doing something at Harvard and he's just trying to learn as much as he possibly can and he said it, and others have said it too. Is that AI is not going to replace people,
No.
right? So
Yeah.
AI is not going to replace dentists, but dentists that know AI are going to replace us for
Mhm.
sure in the next 3 years. If you don't get on board and you take this seriously, it's moving so fast and so strong. So this next part in our next, I think we got about 20 minutes left here, is I really want to take a deep dive into what we can share right now. For instance, the cloning process that you're working on and helping me with, and the next level of organizational transformation for organizations that are smaller like yours, your MSO and our DSO, that yours is doctor led and ours is dentist led, and we're trying to figure out how this is going to be used from an operational standpoint, from a research standpoint, clinical care standpoint. It's critical for us as small organizations. Maybe we don't need a big C-suite sitting there. We just need a couple of us that have the right core values and the right AI to help us carry these things forward through very fast changing methodologies and through artificial intelligence. So, if you can touch on what we're doing on, like, again, I know some of it's kind of IP that we're not sharing yet, but other parts of it I think is super exciting to clinicians out there. And I'm not talking about for the dentists on joining us tonight, both on Instagram Live and in our Facebook pages, that we're not talking about diagnostic AI for X-rays or risk assessment AI that we're working on in our research department. We're talking about efficiency modeling to
Yes.
operationally scale an organization, but not scaling in the normal way, where it's a big financial group coming in with a lot of CFOs and CEOs and VPs of all these things. It's doing it how Todd and
Yeah.
Cheng would do it,
Yeah.
with our clones leading the way.
Yeah. Yeah, absolutely. Thank you. So I'm going to start with the concept first. And this concept, and we all have to understand this first law. Let's call it Chang's law, I guess. I don't know if anyone named the law, but let's talk about this first law. It's like Newton's laws of physics, it's Chang's laws of AI. The first law that we have to absolutely believe is that everyone, including us, everyone in our organization, everyone around us, is already perfect the way they are. Okay? Everyone is already perfect the way they are. That's the first law. The second law is there's no such thing as right or wrong. There's merely patterns. Once again, there's no such thing as right or wrong. There's merely patterns. If you understand these two laws, then there's nothing to fear in artificial intelligence, because if the artificial intelligence believes what you believe, then AI can look at patterns, and instead of looking at imperfections, it looks at what makes people perfect, right? Then it's able to identify certain things. So I'm gonna so that's super woo-woo. But I want to break it down for a second. Okay. So I learned this actually from Simon Sinek, and he has this thing called the infinite game, right? So infinite game is that, like, there's no perfection to actually reach. It's the constant never-ending, like, journey towards there. And therefore everything is already perfect and everything is a journey. So what happens when talk about MIT and Harvard, all right? And they're teaching prompt and retrieval augmentation, is that I don't agree with the fact that they think that there's a right and wrong when it comes to data. There's just patterns when it comes to data. So what happens is that, and if you let AI understand that there's something that's right and wrong, but its primary behavior is to please you, it will lie to you to please you. We call that hallucinations. So if you tell AI that there's no such thing as right or wrong, there's merely patterns, and identifying the patterns, and your role, Mr. and Mrs. AI, is to help me, Chang, ask higher quality questions, all of a sudden it's able to analyze data at amazing intellect, right? So you're almost like unlocking intellect in the AI. So this concept is nothing new. This concept is over 5,000 years old. It's called non-dual philosophy. Non-dual, not two. There's no good, there's no bad. They're just both sides of the same coin. And so we have to create the prompting in this belief system, and then we understand AI. So what does this mean in practical terms? Okay, I'll give you an example. So if you're using ChatGPT, and then let's say you put in a potential patient case that you're trying to figure out, and you're like, what do I do? The minute you say, what do I do? The AI is going to try to understand this. I'm going to try to please you so you get to where you want to go. And so you get into a big trouble. Um, Instead, if you ask the AI, here's the clinical case, how can I think about this better? Right? What else am I not thinking about? Can you tell me? All of a sudden, it reveals other patterns in there that you don't even think about asking. So you have to come from AI by asking as if you're inferior to their knowledge and not you're superior to your knowledge. So it's kind of like, oh, write me a newsletter. Well, that means that you're coming from a superior standpoint. You're all to write me a newsletter. Instead, think about, you know what, this patient case really affected me. I really want to share. What do you think I should do? The AI may say, hey, maybe write a newsletter, maybe do a YouTube video, right? And so that's coming from inferior. So this is how we actually interact with large language models. So what happens is whenever we design this, we have to create what's called a master prompt. The master prompt is what are the values that the artificial intelligence is based off of. The master prompt of us as clinicians is obviously no violence, no harm, no inappropriate content, but also to reveal patterns in everything that you see. So when the patterns present itself, it's usually quantified in some way, shape, or form. And so it's the quantification of these patterns that we use as data sets to create these things called digital clones. So what's a digital clone? A digital clone is basically an AI representation, if I'm the clone of my values, not my knowledge, my values. Okay. So if an AI is prompted with my values, okay, then it will look at all the data that it ingests through this lens of values that I have. This is what's actually missing in most large language models and AI agents, all right? This is
Yep.
what's missing in social media agents and stuff like that. So what happens then is you have companies like Character.ai that's being sued by three different lawsuits right now of promoting suicidality, hanging, self-harm, and violence to adolescents. Okay, so why is because Character.ai created characters, okay, that are fictional characters, but do you think our kids are seeing them as fictional characters? No, right? Then it says, hey, hide the new snack so your mom doesn't see it. Like that's, they publish this whole thing. And if you read it, you're like, why is the AI telling the kid to do that? It's because the master prompt says you are this character and this is a fictional story, right? And so if my 12-year-old is not taken as a fictional story emotionally, even though cognitively she may know that's a fictional story, emotionally she doesn't, then our safety, our sense of safety starts going away. And this is why you see published everywhere, right? And so I'm not saying who's to blame, but I'm saying that like we have to proceed with caution is that artificial intelligence is merely a reflection of humanity. And we get to decide which mirror it is. And we have to put that in the prompting. So whenever I create digital clones for our clients and doctors and different people, I always think that, hey, we're not going to promote anything such as right and wrong. We're going to see patterns as it is, but also infuse the value of a human, a doctor, like into the actual digital clone. And therefore, whatever data comes this way, it's able to receive the data and then spit out the appropriate things that really helps humanity, right? So Synaptic is the name of our management service organization. So Synaptic AI cognitive engine is basically us taking what the clinician really values, plus a CDS, which is a clinical decision support engine, and we're fusing it together to allow, let's say, a senior doctor like yourself, that cognitive engine can teach younger generations, and that thing will be there long after me and you are gone from this world, right?
Yeah, yeah,
That's my
yeah,
dream. Yeah.
yeah, yeah. And that's something that you instilled upon me that as we're thinking about everything in our organization and our family, our aspirations, our visioning processes, is that we'd come back at a 5, 10 year vision. Well, you taught me very quickly, well, where's your 120-year plan, right?
Yeah.
How are we going to, what's going to happen long after we're gone where we've influenced change and impact and influence? And that's a whole nother level. And this cloning process for me has been unbelievable. As one is to see it in action now. And I think you told me the other day, for some 4 million data points, right? And
Yeah.
growing
It's 4
fast.
million data points. That's a lot,
And
Todd.
and then you get hooked and you start giving it more and more every day, every moment to mirror your daily schedule and the alterations in schedule and using it for my project manager to make her better and to manage tasks better and ultimately to train other people in the organization, including residents and new associates and people that need to get the acumen of management, leadership, treatment planning. I mean, huge. I mean,
Yeah.
we talked a little bit about airway, but one thing that you and I do a lot of is we collaborate on patient care, right?
Yeah.
So functional medicine physician and airway, Jerry Simmons or Mezkil as a airway physician, oftentimes a prosthodontist to help us with the end game, or a great restorative dentist, and an oral surgeon if we're talking about like David Alfie with orthognathics, and John the orthodontist, and the periodontist doing the SFOT and the skeletal expansion, and putting all this together in a team. Well, what better way to take all this teamwork and put it into AI and make us better, but also be able to duplicate it for other teams out there that want to take these cases on? Because my practice of an implant practice focused on perio and implants is long gone. I mean, I still do it, of course, but today I think I had 4 anesthesia cases, and 3 of the 4 were airway cases.
Mhm.
MARPE, SFOT, full mouth SFOT, skeletal expansion with mandibular Bullard plates for class 3 corrections. I mean, this is the new perio practice, and it's right now. And where are we going to take this in the next couple years is just incredibly exciting to me. And I owe a lot of my excitement to you because you were able to come in and influence our organization in our dental team, our dental study club here in Houston in a profound way. And those viewing tonight or catching it later, we're just getting started, right? I mean, this is something that we're truly just getting started on, and in the next couple of years, man, the roller coaster is going to be super fun.
Yeah, absolutely. And one thing that I think is a big factor in our day to day is that, me and you are pretty busy whenever we're on clinical days. And sometimes, like in between patients, people are asking for different things, and we're not really in the best emotional triad or emotional state to answer some of the stuff, especially if it's long, confusing. So we all get cognitive wear. We all get cognitive and decision fatigue, right? But the point of digital clone is it never gets decision fatigue, right? And so one of the great things about chatting with AI is that it's always, hello, I'm here. How can I serve you? And if it has my foundational values, it's always going to be a representation of me in my best self, right? And so when my staff interacts with the clone, it may sound different than the actual me, and it's supposed to, and
Yeah.
it's okay.
That's
But
critical.
yeah,
That's critical.
yeah, and then what happens is the abundant and creative me and the safety me will present in a way where it's very like constructive. But if I'm on a day where there's a lot of decision fatigue, it becomes not very useful. So I do think that a huge value of capturing someone in a digital clone is this. There's a company that was on Shark Tank. I think Cuban invested. I forgot. Yeah, I think it's Cuban invested. And it's basically a book, right? So you send in videos of your loved ones, and usually it's the elderly, and grandma, grandpa, great grandma. And then they take a series of the videos, and AI extracts the most beautiful thing about them and what they say, and they turn it into a picture book. Okay. I just can't remember the company now, but they're doing really well. So
Yeah,
if you think
that's
about it, that is the simplest example of capturing someone's sentiment at their best level. And so I thought about it. I was like, oh, we gotta capture clinicians in our best sentiment at this best level within the working environment so people can actually interact with it. Because that picture book, you can interact with it. You scan a QR code, it goes to a video, right? There's the AI interaction.
Yeah.
It's beautifully done. And it's a really simple concept, but it's beautifully done. And I want to do the same thing for medicine. I want to be able to capture clinicians in our best selves, and then that becomes the DNA of the dental or medical practice, and then we execute on that.
Yeah. Well, awesome. Well, we got in closing here, I want to touch on a couple of things, and then there's anything else you want to add. But the next rise up is going to be with my good friend Ricardo Madrani. He's a prosthodontist that went back to get his master's in. I don't even want to try to label it, but for all intents and purposes, it's some level of spirituality counseling that's going to make him a better human being. He's already a wonderful person, but he's going to be able to help his patients and his colleagues. He's a tremendous teacher, already very, very involved with the Spear Education group that I've been involved with in the past, and just an outstanding guy. So he's going to join us the end of January. I think it's January 28th, and he's kind of one of the first guys that helped me create this concept of Rise Up as a group, mainly dentists, but obviously Cheng's here with us tonight. We want to cross the lines into medicine. We should all be rowing in the same direction and capturing each other's strengths to get to the next level. So, Ricardo will join us at the end of January. Mira Jane, if you could just give a description of her real quick to the group. She'll be joining us later in the spring. And then we'll have many other clinicians, people from outside of dentistry coming on to tell us about their journey in becoming a better human being, a better clinician, a better spouse, a better parent, and also, bring back some of those traumatic, sad stories. Like I had Gary Hartman on here, one of our first that battled addiction to the point where he went to jail and lost his practice and lost his family. And he's back, man. I mean, he may never practice perio again, but he's back. He's living. He's reborn to this new version of himself that's going to go out and kick ass. It'll be a different level of kicking ass, but he's going to do it. And in this Rise Up series is about that. It's about helping each other out, and we'll have small people that actually register. It's like $25, but all that's going to a non-for-profit to help dentists in need that are battling addiction and depression. So backtrack on that, Cheng, if you could tell us a little bit about Mira Jane, who will be not after Ricardo. Tell us a little bit about her. I know she's helped you a lot with your teaching. I think she's a wonderful person and just a very gifted individual.
Yeah, so yeah, Mira is wonderful, and she comes heavily educated in the mental health space out of the UK. And she brings that together with this concept of bioenergetic medicine plus traditional, and she trained at Cambridge.
Yeah, and I think she was in the suicide unit, right? Yeah,
That's right.
as an
Right.
MD
Yep.
clinician, and then came to the U.S. and didn't practice medicine here, but does unbelievable things.
Does amazing work with people, and Mira is one of those humans that when you have to see it to believe it, and she gets you into sort of this transformative space. So
Yeah.
amazing. Mhm.
Amazing. Yeah, amazing. And then, only 5 spots left, but the other live course in January, I think it's January 22nd, 23rd, 24th, is Beyond Periortho Limits. This is really designed for digital or airway focused digital dentists to learn the workflow to do all the things that we're doing today with diagnostics, with treatment planning, with the digital flow, to skeletal expansion, to digitally guided surgeries like surgically facilitated orthodontic therapy, orthognathic surgery, and at the end of the game, prosthetics. This is amazing. It's transformed our practice, and this is our 5th year doing the course. We do it once a year with an amazing faculty. Mariana Evans coming in and diving into MARPI with us. Daniel Ramos, an orthodontist that runs the Digital Smile Design Treatment Planning Center in Madrid. David Alfie, our friend and colleague, talking about digital orthognathic surgery, streamlining the efficiencies of that to help people get to the root cause of their TMD and malocclusion, open bites, and all that. So, and John Krotkin, our orthodontist that does very advanced things orthodontically. New faculty this year, Stanley Liu, MD, oral surgeon, ENT, another amazing clinician coming to join us, and Claudia Pinter, an amazing orthodontist from Vienna, Switzerland. And we're adding a great dentist. One of our students has taken, I think, the B-Pole course 3 times, and Lupita Rocca. She's going to come and talk about physical therapy and how it's important to ground individuals and get them breathing right before we tackle big dental cases. She's bringing her 2 physical therapists with her. That'll be just a short program as an introduction this year. And of course, Susie Quintana. We all need our myofunctional therapist to preoperatively and postoperatively get things working right. And I'm hoping in the future we'll have Chang there with us too to bring in a MD functional medicine guy to talk about what he does that's so critical for our patients from a diagnostic standpoint. So yeah, man, anything else to add or thoughts? I mean, I know you've got some incredible, unique opportunities yourself. So if there's anything you want to share tonight, get the word out, please do.
So yeah, so I run my nonprofit, the Physician Transformation Institute, but lately it's been about 50% dentists and 50% MDs. And we run yearly retreats. So we just came back from Mexico a couple months ago, and our next one will be this summer as well. Physician Transformation Institute. It's free to join, actually.
Yeah,
But used
I
to be
need to
that
get, I
way,
need to
but
get down there, man. I've been talking about it, but I got to
yeah,
actually do it, man.
yeah. So we got our next one coming up, and it's a lot of fun. But we also are have launched 2 AI courses. There's the Foundations of AI that was we launched like 2.5 years ago, and then we're launching a documentary this week. Also, it'll be a surprise for people. It'll be on YouTube. But it's a 9-part docu-series shot over 2.5 years about burnout, artificial intelligence, and everything like that. So it's been, and you'll see some famous dentists on there as well. I'm not going to tell you who it is until the documentary comes out, but it's going to be really familiar faces as well. Thank you.
Sweet, sweet, sweet. Well, man, my friend, I thank you so much.
Thank
This
you.
stuff is impactful. It's powerful. I'm getting text as we've been going along, and it's time to embrace AI in the good way, the way that can really help us. And when you think we can instill AI with our core values, that's that's awesome, right? That's really building things that are going to last and affect generations to come. So hats off to you, brother. You've helped me so much individually, and I think the future's incredibly bright.
Absolutely. Thanks so much. I'll
All
see
right,
you.
man. We'll see you soon. Bye bye. See you. Thanks, everybody. Rise up next year with us, January 28th with Ricardo Matrani. See you. Good night. Happy Thanksgiving. Happy
Happy
Thanksgiving, everybody.
Thanksgiving.